Hey guys, welcome back to another episode of 5 Minute EMS Review. Today we are continuing our series on components of an EMS call with the secondary assessment of non-critical trauma patients. So let's define a non-critical trauma patient. A non-critical trauma patient has no life-threatening injuries and no injuries that are going to compromise any of the patient's limbs. In addition, there is not a concerning mechanism of injury. And by that, I mean that there is no concern on the part of the paramedic that the mechanism of injury could be producing a life threat or a limb threatening injury that may not have presented itself yet, but is still a possibility. So as long as we're not concerned with a severe mechanism of injury and there are no current life or limb threats, we can classify our trauma patient as non-critical. Now, what do we need to perform as part of the secondary assessment? Obviously, we've done our primary, we've looked at our ABCs. So now we want to start digging into the chief complaint and information about the nature of the injury. We're going to need to perform a physical exam, look at vital signs, and past medical history. Now, the key here is that the physical exam is usually focused, and we're going to focus it on areas of the body based on the patient's chief complaint and mechanism of injury. So an example, the basketball player who rolled his ankle, he's given us a chief complaint of his ankle hurts, and he's telling us the mechanism of injury that he was playing basketball and he injured it. That's going to lead us to look mostly at his ankle. We're probably not doing a detailed full body assessment on this guy. So that's how we can focus our physical exam in. Still need a physical exam, but might be a little more limited in scope. And then the other thing that is important is that we still need a past medical history. We want to ask that of all of our patients, but it may not be as relevant to us as it is in a medical situation because, again, using the example of the basketball player, his past medical history may not have a whole lot of bearing on the ankle injury that was experienced today. So that might not be our first priority. With these patients, we want to manage any injuries appropriately, and we want to reassess them at least every 15 minutes, if not a little bit sooner. That's the non-critical trauma patient secondary assessment. Next up, we will look at the critical trauma patient. So tune back in for that video, and please pass us along to any of your friends or colleagues who may be looking for a study aid. Thanks, and we'll see you on the next one.